This is Train Your Body with Melanie Cole and expert guests from the American College of Sports Medicine on Radio MD.
Recently, the U.S. Surgeon General launched a campaign to help address major health epidemics like diabetes, heart disease, and obesity with walking for optimal health. Seems easy? Well, we certainly hope so, and we certainly hope the country jumps on board. My guest today is Dr. Bob Sallis. He's family physician and sports medicine expert. Welcome to the show, Dr. Sallis. It's been a while. I'm so glad you could join us today. Tell us about the U.S. Surgeon General, and you're at Kaiser Permanente, right? And this is where all this is going down.
Yes. Hi, Melanie. Thanks for having me on the show. Yeah, this was very exciting last week. We launched the Surgeon General's call to action to get Americans walking and make our communities more walkable. And it's very exciting because, for me, especially because we held it at the Kaiser Permanente Center for Total Health in Washington, D.C., which is a meeting center that's connected to one of our Kaiser Permanente clinics there. And as you may know, we sort of have instigated this in a lot of ways with our previous CEO, George Halverson, starting a campaign called Everybody Walk. And it was amazing how that developed into a large collaborative effort that involved our previous Surgeon General, Dr. Regina Benjamin, and really set the wheels in motion for launching a call to action to get Americans walking. And so it was very exciting to see that finally happen. And our current Surgeon General, Dr. Vivek Murthy, was there to provide some great comments, and we had a host of representatives from all kinds of different branches of government there, and it was a great day, and it culminated in a walk around Washington, D.C.
Cool. That's so cool. Now, I remember when Dr. Benjamin was involved in all of this, and we spoke with her numerous times, and it was such a great initiative, Dr. Sallis. And Washington, D.C. recently topped the fitness index. So, yeah, I mean, it's great for them to get out and doing it, but they're already doing it. So what do the rest of us do to take up this initiative and make our cities more walkable?
Well, really it has to involve multiple sectors of society. My focus has been mostly on the healthcare sector, asking that doctors simply assess the physical activity habits of their patients at every visit and make a formal walking prescription, and to really help patients understand how walking can benefit their health and tie it directly to the diseases that patient is seeing you for that day, or that they have chronic diseases that they're managing, or diseases that they're worried about, because we know exercise and walking has a powerful effect in prevention. So that's just one of the segments. We need to make the streets more walkable with, big sidewalks that are inviting and encouraging people to walk, that are safe and well lit. We also need public transportation to support walking, to make driving a car harder, because we know that people who live in cities with good public transportation tend to walk a lot more than those of us who live in cities where we have to rely on the car. We have to tap into our education system and make sure that we have physical activity emphasized in school, and that kids have PE and leave school with a lifelong plan for fitness. And so you can go on and on and on. Our media, our public health, all of these need to turn their focus onto physical activity, and particularly walking, to me, because in my mind it's sort of the default prescription for exercise is to get people walking 30 minutes 5 days a week.
I agree completely. I mean, it's certainly my default prescription as well, Dr. Sallis. With all of my heart patients and my clients, it's the single biggest thing that I recommend when they say, what should I do? It is to walk. And I myself am a huge walker. I can walk for miles and miles and miles. It's my favorite thing to do. Now, when you say it involves communities, and I've seen what goes into this fitness index, and I've talked with Dr. Thompson about the enormity of this project. So when you say sidewalks and things, I mean, that's huge. You're asking communities to completely change their structure and infrastructure. What can we do right now to get people walking? What can we do in this call to action right now in our communities, and even in these urban communities where maybe they're afraid to go out walking?
Yeah, well, certainly this is not going to change overnight. We've got to have something to aspire to. We've got to push our city planners to develop communities that are more walkable, and there's so many great reasons to do this. Even beyond health, we know that cities that are walkable, the property values are higher. People want to live there. This is something the public is clamoring for. So I think while it sounds really daunting, there are some things easy fixes that can be done very quickly to make the communities more walkable. But that said, certainly right now, it's I think just making people aware of the health benefits, trying to me, tap into social media, I think, is very important, that we make walking fun again. It's always astounding to me to think that when I was a child, if you ask most kids, myself included, what my favorite subject was, it was PE and recess. That was the most fun part of my day. How did it go from being the best part of your day to something we now have to coax people into doing? It just doesn't make sense. And I think because we have taken some of the social and fun aspects out of exercise and turned it into exercise as opposed to play. And so I think the more we can change it around and make it a social event for people, that you have groups that go for a walk together, that you walk your dogs together, instead of dinner and a movie, you'll do dinner and a fun walk around a well-lit neighborhood or downtown area that's got great restaurants and bars and people watching. I really think we can make this happen with just sort of a change in attitude.
I agree, and I don't think it has to be, as you say, a walk for exercise. People hear that and they go, oh, forget it. But a walk around a cool neighborhood, a walk around where there's bistros and people watching, just to walk or to go into a nice city. I'm in Chicago, and boy, do I love, my feet burn after a long day of walking in the city, but it's totally awesome because you're seeing so many things. So first, good suggestion that walking doesn't have to be exercise. It doesn't have to be mundane. It can be something you do just absolutely for pleasure. I like to recommend some of the new technology, Dr. Sallis. What do you think about that for helping? Like a Fitbit gets you out walking, gets everybody kind of in competition with each other, and even at workplaces. To hand everybody a Fitbit and say, who gets the most at lunch? Take a half an hour of your lunch and go walk.
Absolutely. And most of us, are carrying around an activity monitor in our pocket with our cell phones. And, these apps are getting better and better at tracking us. In fact, the new iPhone has got a little activity monitor that I've sort of just gone to that because it's so much easier. I typically have my phone in my pocket all the time. Although a lot of women may carry it in their purse and may not have it with them at all times. But there's just great technology out there to keep an eye on things for you. And I think it's just a great reminder to check on that every day, every week, and see where you are. I know a lot of my patients, when they see at the end of the day they've only done, say, 8,000 steps, they go out and walk for 10 more minutes to get it up over that 10,000 step a day goal that each of us has.
Okay, so we just have about 1 minute left, Dr. Sallis. Best advice for the listeners out there to get involved in this initiative by the U.S. Surgeon General, Dr. Vivek Murthy, and getting them out and walking. This is a great initiative, and I certainly applaud you for being involved.
I think it's getting out and encouraging your friends, particularly friends who have chronic diseases or at risk for chronic diseases. Getting them up and moving is so important, and I think if we get together in groups and go for walks and make it more social, make it more fun, I think that's a grassroots effort that could really catch hold, and it wouldn't feel like we have to convince people to do it. I'm hoping that they're going to sign up and want to do it. And then along the way, I think all of us pushing for, give us nice places in each of our communities to walk, and we're seeing more and more neighborhoods become more walkable. And they're really thriving because of it. So
absolutely.
We hope that this is simply the beginning of a movement, and I'm really feeling it. The Surgeon General was just one more piece that came behind this movement, and I hope all of us can continue to push it forward, to believe in it.
Absolutely, and you heard that from Dr. Bob Sallis from the American College of Sports Medicine. You can go to surgeongeneral.gov for more information on this walking initiative. This is Melanie Cole. You're listening to Train Your Body right here on RadioMD.com. Thanks for listening, and stay well.